The gift of life is the greatest gift of all. Please don't take your organs to heaven. Heaven knows we need them here.
You were the first person to do a liver transplant surgery in the country.
Right.
I believe you've done over 3,500 liver transplants.
Well, nearly 5,000 now.
Oh. Hello and welcome to First Check. India has made great strides when it comes to organ donation. We recorded over 18,900 organ transplants in 2024, the highest ever recorded in the country so far. This was in fact double the number of such surgeries that happened in 2020. But this is still significantly less than the demand that we have for such donor organs in the country. Official data shows that about 2.5 lakh people need kidneys, 1 lakh people need corneas, 80,000 people need livers, and 50,000 people need hearts every year. So, what are the challenges that is creating this gap, and how do we bridge it? To answer those questions, First Check caught up with Dr. Arvinder Singh Soin, who's the pioneer of liver transplants in the country. I believe you've done over 3,500 liver transplants.
Well, nearly 5,000 now.
Oh, close to 5,000 now. And there's also a Padma Shri awardee. To understand more about the current scenario when it comes to transplant. But before we get into that, Dr. Soin, I just wanted to talk to you. I was reading about your work, etc., and it really is inspiring. I believe you were the first person to do a liver transplant surgery in the country. Right. That was back in 98.
1998.
Cadaveric in 98 and live donor.
Also in 1998.
Yeah. So tell me about that. How was that? Because I can imagine it being a slightly crazy conversation, trying to convince a patient to put in somebody else's organ into their body, and to do that for the first time ever in the country. How did that play out?
So I was at Cambridge University for 6.5 years before that, and I was routinely doing liver transplants, kidney transplants, pancreas transplants from deceased donor organs, right? Which are basically donors that die a brain death and their next of kin agrees to donate organs. So that was pretty routine back in the UK when I was at Cambridge. And then I started transplantation in Delhi at Apollo Hospital. So when we got going a few months down the line, we prepared everything. And then in November, on the 5th, 6th November night, we had a brain dead person in the ICU within the same hospital. And we spoke with them because somebody in their family had donated eyes earlier. And eye donation is a little different from brain dead organ donation, because eye donation can be done by anyone dying any kind of death at home, on the road, etc., or in the hospital. But brain dead persons donating organs only happens in neuro ICUs in a hospital, where they are brain dead, the other organs are functioning, they are kept the other organs are kept going on a ventilator and other ICU support. So that kind of situation is different, and it only happens in 1% of the deaths. So on November 5th evening, when we got to know of such a person, and they had expressed a wish to actually donate organs, just because somebody in their family had donated eyes earlier, right? Corneas. So back in the UK, I had that system where there were transplant coordinators, there were counselors who actually spoke to such families. But in my hospital in Delhi, this was very new to everyone. There was no system or team to actually make that happen. So I and my colleague surgeon, we actually counseled this family, and they agreed to donate organs. Of course, the Organ Donation Act was in place. So the documentation was possible. And obviously, any modern ICU could declare brain death. So the procedure, although hadn't been done before, was not undoable. So it was possible to do it. The family, luckily, because they had been primed by a previous donation in their own family, they agreed to donate organs. And then we had 2 patients on the waiting list, and we spoke to each one of them whether they would have that organ. And one of them actually agreed, because he was told that he didn't have more than 2 or 3 months to live if he didn't actually have a liver transplant. And I also told him that, look, it's very new for this country. This is the first case in this country, but I've done hundreds in UK, and this was pretty routine to save patients dying of liver failure with liver transplants, and this is the only shot you've got. So why don't you agree? So he and his family agreed, and we went ahead with the country's first deceased donor liver transplant on the 5th, 6th November 1998, as in the night of 5th, 6th November. And the patient did well. We discharged him in 13 days after transplant, and that was the first successful transplant of this country. And so in terms of, the surgical challenge, there wasn't much because I had done lots of these procedures earlier, but the system wasn't geared up completely. So we had to do the counseling. No surgeon does counseling nowadays for families. There are separate transplant coordinators and grief counselors that do that. But we had to do it. And then, of course, we did the surgery. We had to take care of the patient in the ICU afterwards. Now there are intensivists that do that, right? So in that way, of course, the system wasn't that geared up and we had to do everything. And that in itself was a unique experience and a challenge. But it worked out well. And that really got things going in India as far as transplantation is concerned.
Well, that's interesting. But now, almost 3 decades later, and you say you've done close to 5,000 transplants, surgeries. What has changed since that first surgery that you did, and how it goes about right now?
Lots has changed. So that was the first case, was a deceased donor liver transplant, which means the organ came from a brain dead person. But brain dead donors do not account for more than 20-25% transplants in this country. So majority of the transplants still happen with living donors, right?
And this is about liver donation.
I'm talking only about liver transplants, yeah. So in liver transplants and in kidney transplants, living donation accounts for between 80 and 90% of the transplants that are done in this country. So just like you said, you think 80,000 people need liver transplants. That's absolutely true. But we only have just about 1,000 brain dead donors in the entire country. So the figure of 18 or 19,000 organ transplant you said was actually including the corneal transplants, the eye transplants. So if you leave them out, because I already told you that's different, because that can happen from any dead person, then if you just consider the organs that are transplanted from a brain dead person, there were about 3,500 of them done last year and about 3,000 done in 2023. And the number of brain dead donors that we had last year was about 1,100. And the number we had in 2023 was just 1,000. 1,000 brain dead donors in a country of 1.4 billion people. That's way, way, way too low, right? So that gives you a donation rate of about 0.6, 0.7 per million. And to give you context, the donation rates in Spain are about 58 per million. In the UK are about 30 per million. In the US are about 50 per million. So we have a lot of work to do on that front. And we are just at about 0.7, 0.8 per million.
But why do you think that's still an issue here? When we are a big country, we have a huge population. One would expect our pool of donors to also be huge. But why do we still have reluctance when it comes to organ donation?
There are, again, several reasons for that. And one of the main reasons is that the awareness for organ donation is still not where it needs to be. In the sense that now, for the last about 10 years, the government has been doing a lot of active work in organ donation, in promotion of organ donation, and spreading the awareness across the country, across every section of society. But it wasn't so much prevalent before that. Although the act that allows organ donation from brain dead donors and also from the living donors has been there for over 40 years, 1984, right? But it's organ donation in terms of brain death and then people donating organs is only picking up now for the last 5 or 7 years, right? So one is awareness. And two is, of course, expertise for retrieving organs. But I believe that's not the bottleneck right now. It's just awareness, right? And, people have variously held beliefs that they shouldn't be removing organs from their loved ones who die a brain death because, they may not have the same organs the next time around when they're born. Or people's people haven't understood what brain death is, because in brain dead people, I told you they're on ventilators and they're on life support. So even though the brain is dead, there is perception of life, because if you look at the monitor, the heart is still going, there is a BP. So not everyone understands that such a person is actually dead. So even though obviously the ICU counselors and doctors explain this concept to the relatives, but not everyone's able to comprehend it, right? So they refuse organ donation. Then there is a myth that people think that their religion doesn't allow it. Now there is no actual mainstream religion that does not allow it, but it's just people's beliefs and myths, right? So I think that a lot of work still has to be done, because as I told you, the donation rates are less than 1 per million. And we really have to reach at least 10, 15 per million to have a sizable number of donors and increase the number of transplants.
A couple of interesting things there, but first I just want to talk to you about the kind of misinformation and lack of awareness that you talked about. Have you had to deal with this personally as well in your career, wherein you've had to, or maybe convince is not the right word, but actually had to counsel or talk to people about these sort of strongly held beliefs that...
So Mariam, we don't do that anymore. I told you that surgeons have no role now in counseling families who will be saying yes for their loved ones to donate. That is done by specialists called transplant coordinators and grief counselors, and that is done by the ICU team. By by protocol, the transplant team never interacts with the family anymore, right? It wasn't supposed to even when I did the first case, but there was nobody else to do it, so that's why we did it, right? So, but the answer is yes. The transplant coordinators and the people that counsel families face this every day. So there is an additional element of commerce, which means that a lot of families think that a hospital will sell organs and make money out of them. But there's nothing like that, because every transplant is very heavily regulated. Every patient detail is submitted to the ministry soon after the transplant. What happened to the patient is submitted to the ministry. So everything is under a very fine lens. So there is never any misappropriation as far as, or let's say misallocation of organs as far as deceased donor organs are concerned. But there is a perception in some people's minds, right? So these are all the reasons why organ donations are refused.
In fact, a couple of days back, I just wanted to talk to you about this. I think our Health Minister, Mr. Nadda, JP Nadda, said that there has been an increase in organ failures, and because of which our need for organs has also risen over the past couple of years. Have you seen that in your career as well? Like, are we looking for more donors? The need for donor organs, have they risen? That
is correct. That is true. And as far as liver failure is concerned and liver transplants go, yes, we have seen a rise in end-stage liver disease, liver failure, liver cancer. These are the reasons why people need liver transplants. And that has gone up, and largely because of what we call MASLD, metabolic dysfunction associated steatotic liver disease. So metabolic dysfunction means basically fatty liver disease. What used to be called NAFLD, non-alcoholic fatty liver disease, that means people who don't even have alcohol but have uncontrolled diabetes, have bad lipids and cholesterol, or are overweight or have bad lifestyle, they could basically get liver failure, and that is the leading cause of liver failure now. In India, 4 out of every 10 adults actually have a fatty liver, and as many as 10 to 15% of them can develop serious liver disease if they don't control this in time. So yes, that's the reason the NAFLD, or now re-questioned as MASLD, is the new scourge as far as liver diseases go.
So just pick up on that. So you've seen this increase in liver disease. So has there been a corresponding increase in donor organs or transplant surgeries as well, or is that keeping pace or no?
So transplant surgery is rising. So now in India, we do approximately 5,000 liver transplants a year, which is the second highest in the world. The highest are done in the US at about 10,000, 9,000 something. And now we are second with 5,000. But like I said, majority of those transplants are living donor transplants. So like last year, we did about 1,000 liver transplants from deceased donors and about 4,000 from living donors. But this number needs to rise at least 20 times, 15 to 20 times. So that's the degree of increase that is needed. But then, yes, if you consider that in 1998, we did just one transplant in the country, that was the one that I did. And then slowly the number has actually risen from a few to 100 to hundreds to 1,000 to thousands. And, it's reached this number of 5,000. And I'm sure maybe in the next 5 years, we'll see about 15 to 20,000 liver transplants a year.
I mean, that is this thing but how do we ensure that happens? How do we encourage more people to donate organs? How do we help bridge that gap?
So like I said, spreading awareness. And how do you spread that awareness? It has to be the state that does it. Any number of NGOs and hospitals and doctors and you and I can keep talking about it, but it's not going to happen as a movement nationally unless the government or the state governments and the central government give it a huge push, and they are. Let's be honest and fair. The push for organ donation has never been more. We're definitely pushing this hard, and this needs to be the push needs to continue until we achieve the donation rates that we need. Now, some of the ways in which awareness can be spread. Majority of the states now have a box where you have to tick whether you want to be an organ donor when you get your license, right? That wasn't the case 5 years ago. This has just happened in 2017-18 onwards, right? So that's a big step forward. Then now there is inclusion of the concept of brain death and organ donation in school textbooks. So you have to get this whole information percolating down to society at the kid level so that, when they grow up, they have already imbibed the concept of organ donation. So I think it's a slow process, but it's happening. And then there should be some, SOPs, so to speak, given to people who donate organs. Or, for example, if I donate my loved one's organs, then, I get some health insurance or, something like that, right? So those kind of things have to be built in. You can't actually give financial incentives to people donating organs. That never happens. No society, no transplant community agrees with that. But there should be some benefits given to families of organ donors, right? So that's another way you can do it. And then this conversation needs to happen at the religious leaders level as well. People listen to their religious leaders, and frank conversations where every religion encourages organ donation has to happen whenever there are discourses happening in any religion, right? So then the other way to push organ donation is law allows you to declare brain death whenever doctors are doing rounds in ICUs and they find someone may be brain dead, because they can suspect it clinically. Then you are allowed to, in fact, it's mandatory to examine that patient and see if they are brain dead. So this is called mandatory declaration of brain death, right? And that's law, but still majority of the hospitals don't follow it. Because if that was to happen, then the identification of potential brain dead donors would increase. And then there is a thing called required request, which means that you have to ask the family, if somebody is brain dead in an ICU, you have to ask their next of kin for organ donation. So if these two things are practiced in every hospital that has an ICU where such patients are admitted, organ donation rates will definitely rise. Then there is this concept of a champion. Often in hospitals or even in government departments, there are health officials, and in hospitals there are intensivists, there are grief counselors who want to champion the cause of organ donation. They feel proud that they are able to convert some families to agree to organ donation so they can save lives, right? So, and people should not misunderstand this. This is not about taking organs from people who can be otherwise saved. This is only from people who are dead, but by brain death, because brain death is a mode of dying. So when somebody is brain dead, they are dead. They're not in coma, they can't wake up. So that's for sure, right? So people have to understand the concept, and then people have to be rewarded. People who are working for this cause have to be rewarded for their work in increasing organ donation, saving lives. So I've outlined many ways in how you can actually promote organ donation and increase the number of donations.
Thank you so much, Dr. Soin, for your time. But before we wrap up, if there's one advice or one message that you would have for our audience, what would that be?
The gift of life is the greatest gift of all. Please don't take your organs to heaven. Heaven knows we need them here.
Thank you so much, sir. I don't think anybody else could have put it better. Thank you so much for your time, Dr. Soin, and thank you for all the amazing work that you do as well.
Thank you.
Thank you.